Have you ever wished there was a savings account that worked harder than your checking account, retirement fund, and insurance combined? Imagine an account where the money you put in isn't taxed, the growth isn't taxed, and when you spend it on medical needs, it still isn't taxed. That's not a dream, it's a reality, and millions more Americans will soon be able to access it. Thanks to President Trump's newly signed One Big Beautiful Bill, health savings accounts, also known as HSAs, are about to expand in ways we haven't seen in nearly 2 decades. This change could impact how families across America plan for health care, retirement, and even everyday expenses. So, let me ask you a question before we dive in. If you could save thousands of dollars over your lifetime while protecting yourself against medical costs, wouldn't you want to know how? Stay with me as I break down exactly what HSAs are, how they're changing, and what this means for you. By the end of this video, you'll know why financial advisors love HSAs and why the recent expansion could be one of the smartest money-saving opportunities you'll ever hear about. A health savings account is more than just a place to stash away money. It's a financial strategy that advisors compare to a golden ticket. Unlike a regular savings account, HSAs come with a unique triple benefit. Contributions go in tax-free, earnings grow tax-free, and if you spend the money on qualified medical expenses, withdrawals are also tax-free. This means you're not only reducing your tax bill up front, but also creating a powerful, long-term safety net for future healthcare costs. When you hear experts say this is like an IRA for health expenses, that's no exaggeration. Think about it this way. Most savings accounts give you pennies in interest, while retirement accounts help only when you're older. An HSA gives you both short-term relief and long-term growth. You can pay for prescriptions, doctor visits, or hospital bills now. But if you stay healthy and let your balance grow, you could have a sizable account waiting for you in retirement. It's one of the few financial tools that rewards patience while still offering flexibility, which is why advisors continue to rank it among their favorite wealth-building strategies. Until now, access to HSAs was limited. Many Affordable Care Act ACA plans, like Bronze and catastrophic plans, didn't qualify because they covered too many upfront services or had higher out-of-pocket limits than allowed. But that all changes in 2026. Under the new law, Bronze and catastrophic ACA plans will become eligible, unlocking HSAs for nearly a third of all ACA enrollees. Imagine the impact. Millions of families who were shut out will now have the chance to save in one of the most tax-friendly ways available. This is the most significant HSA expansion in almost 20 years, and it's not just about numbers on paper. When you realize that around 30% of ACA enrollees already choose Bronze plans, you see how massive this change will be. Families who once saw their healthcare premiums swallow up their budgets now get a tool that turns their coverage into a savings opportunity. For the first time in a long time, insurance and savings are working together instead of against each other. Direct primary care arrangements are another big winner in this expansion. These plans let patients pay a flat monthly fee, usually up to $150 for an individual or $300 for a family, to get direct access to their primary care provider. Starting next year, those fees will not only make you eligible to fund an HSA, but also count as qualified medical expenses you can pay for directly with your HSA money. That's a double benefit. Your routine care becomes simpler, and your savings account works harder for you. Telehealth coverage is also included in the expansion, which is huge given how common it has become. In 2022, about 30% of adults in America use telemedicine. Before the law, if your high-deductible plan covered telehealth before you met your deductible, you risked losing HSA eligibility. That barrier is now gone. Even better, this change is retroactive back to January 1st, meaning many families can already benefit from it. These updates show that lawmakers are finally catching up to the way healthcare is actually delivered today. The advantages of HSAs stretch far beyond just saving on taxes. Unlike a flexible spending account, where you have to use the money within a year or lose it, HSAs let your money roll over indefinitely. That means every dollar you put in today could still be there and growing 10 or 20 years from now. Over time, this compounding effect turns your HSA into a powerful retirement asset. For families worried about the rising cost of healthcare, this can provide peace of mind and a practical plan for the future. Another unique feature is flexibility after age 65. At that point, you can withdraw funds for non-medical expenses without facing penalties, though you'll pay regular income tax. Essentially, your HSA becomes another retirement account, with the bonus that it was designed to cover medical needs along the way. Add to that the possibility of employer contributions. Many companies add money to encourage workers to join high-deductible plans, and you've got a savings vehicle that can snowball into serious wealth if used wisely. When open enrollment rolls around in 2025, families should take a close look at their options. If your ACA plan or employer plan qualifies for an HSA, this is your chance to act. The earlier you start, the more years your contributions have to grow tax-free. Even if you can only afford to put aside a modest amount, it still lowers your taxable income and builds a cushion for emergencies. The key is consistency, contribute regularly, and treat your HSA like an investment in your future. It's also important to think strategically. Ask yourself, would you rather pay taxes now and struggle later, or cut your tax bill today while preparing for tomorrow? By choosing an HSA-eligible plan, you're giving yourself the opportunity to do both. Consider it a way to protect your family's health and finances at the same time. With medical costs only rising, there may never be a better moment to take advantage of these new rules. Health savings accounts have always been one of the smartest ways to save, but with the changes in the One Big Beautiful Bill, they're becoming accessible to millions more Americans. Whether you're on an ACA plan, using direct primary care, or relying on telehealth, this expansion could be your chance to start saving in a way that reduces your taxes and builds long-term security. The message is clear. HSAs aren't just for a select few anymore. They're for families across the country who want to take control of their healthcare future. Now, I'd love to hear from you. Do you currently use an HSA, or are you planning to take advantage of these changes when open enrollment begins? Share your thoughts in the comments below. I'll be checking and responding. And if you found this breakdown helpful, please make sure to like this video and subscribe to Social Security Post so you never miss updates that could affect your finances and benefits.